Medicare Part D's deductible can be very confusing to understand, hence this question, so let's talk about it. In 2025, the deductible can be as high as $590. You're going to see some plans with zero deductible, but typically those plans have a very high monthly premium. So before we get deeper into the deductible, when you're thinking about a Part D drug plan, yes, you want to understand the different components to it, premium, deductibles, copays, but ultimately you're making your decision based on the total cost for the year. Because a plan with a very high monthly premium could end up costing you a lot less for the year than a plan with a very low monthly premium. So just be aware of that. So when it comes to the deductible, when I first started doing this work, I was confused by this too, because you see a deductible, you think it means you have to pay that full amount before the plan does anything for you, but that's not necessarily the case. A lot of these plans will have drugs on lower tiers where they'll say, you know what, we're going to cover those drugs for you without you having to meet the deductible. We're saying it's not part of the deductible discussion. So you may have a tier 1 drug. Let's say it's a preferred generic and they give it to you with no copay, even though you haven't paid a dime towards your deductible. Where the deductible comes into play is when you have tiered drugs that are higher up and you're going to have to pay the cost of that medication. That could be the full deductible before you get into the initial coverage stage. So for example, this is not exactly accurate, but let's say you take Eliquis and it's a tier 3 drug and it's $600. And your plan has a $590 deductible, well, boom, you're getting hit with that deductible, and then you're gonna move into the initial coverage stage for the rest of the year. Some of you may have medications, they're not that expensive, and let's say you're on a medication and it's $20 a month towards the deductible. Every month you're gonna keep paying $20 till you hit the deductible. And if you're on multiple medications, that could happen sooner. So I get why it is confusing, but again, repeating myself, focus on the full out-of-pocket cost to determine which is going to be the best plan. And one thing I want to point out to you, if you are somebody that does have to meet that deductible really early on and it feels too cost prohibitive for you, life's expensive in retirement, people are on budgets, there's a program now, and it's called the Medicare Prescription Payment Plan. Once you enroll in a Medicare Part D plan, you have the ability to enroll in this program through the plan where you can spread the costs out evenly over 12 months. It doesn't lower the cost, but it could take away that initial blow of having such a big payment in that first month if you're somebody that has to meet that deductible from the get-go.